Okay, so now we're going to talk a little bit about hormonal methods of birth control. These include pills, patches, rings, injectable types of contraception, and in this video we will cover emergency contraception, even though not all of it is hormonal. The most popular option for a lot of people are combined oral contraceptives. They use a combination of estrogen and progestin to block ovulation. We should never have estrogen unopposed in a birth control pill. It greatly increases the chances of adverse events. They are supplied in a pack, and the female partner, takes one pill per day. If it's used perfectly, 99.7% effective. However, typical use, because it relies on human behavior, is 93%. Some formulations have a week of dummy pills that allow for menstruation, and some are extended and delay vaginal bleeding for 90 days, like Seasonique. The cost, depending if you have insurance or if you go to a clinic that subsidizes this, it could be free. If you're paying completely out of pocket, it's about $20 to $50 a pack. Okay, advantages of combined oral contraceptives. They are highly effective if used appropriately. They don't interfere with spontaneity of your relationship because you only have to think about them once a day. Additionally, they have some benefits not related to birth control. They decrease premenstrual syndrome, decrease menstrual cramping, and they decrease blood loss during menstruation. So for somebody who has heavy, painful periods, this is a great method. It decreases pain from endometriosis. It decreases acne. It decreases the signs and symptoms of polycystic ovarian syndrome, which is, associated with high levels of androgen. It may decrease bone thinning by providing estrogen, which has a protective effect on bone. It decreases the risk of certain cancers, endometrial cancer, ovarian cancer, colorectal cancer, and decreases fibristic breast disease, ovarian cysts. It can be used to regulate the menstrual cycle. So for women who have irregular menstrual cycles, this is useful, and also it allows the patient to manipulate the length of the cycle for certain occasions, for example, your wedding or a vacation, by either continuing to take pills or stopping them like a week ahead of time so that that's out of your way. It is not invasive, and it can be obtained through mail order prescription services like Nurx or Hers. Side effects? A lot like pregnancy, breast tenderness, it kind of mimics the natural state of pregnancy. You're adding the hormones that sustain normal pregnancy. So breast tenderness, nausea, headaches, and spotting. All common in the first trimester. These tend to go away over time. Adverse effects, we need to talk about them. More common in the older preparations that use much higher levels of estrogen, which was unopposed by progestin, but still a factor when you're making a decision. It does increase the risk of blood clots. Now, pregnancy actually increases it more until you get to the age of 35 when that sort of evens out. But anything that, stroke, pulmonary embolus, it can also stimulate a certain type of breast cancer cell to multiply, those estrogen-sensitive breast cancers. It's contraindicated in certain patients. So there's a whole class of patients who should not have combined oral contraceptives. If they're 35 years or older and smoke, and people with any kind of vascular issue like a history of stroke or heart disease, severe hypertension, diabetes greater than 20 years, or diabetes with vascular complications. Patients who have migraines with aura should not have this. If you have any history of a DVT or PE, this is off the table for you. If you currently have breast cancer, you should not be prescribed birth control pills. And if you have any type of severe liver disease, it is processed in the liver. What you would teach your patients: the pill is most effective when you take it at the same time every day. The combined pills are not as big a problem as the progestin only, but we'll talk about that. But if you remember to take it at the same time every day, you're more likely to be consistent. The most common reasons for failure is forgetting to take your pill, losing your pack, forgetting to refill on time. If you miss one, it's okay. Take it as soon as you remember, you're still protected. If you miss 3 or more, you need to consider yourself fertile and use a backup method for the remainder of your cycle. Tell your provider about every medication you use because sometimes they make the pill less effective. For example, I've listed some here. Even herbal supplements like SAMe or melatonin that are used for depression or sleep can interfere with the pill. But seriously, HIV medications, rifampin, antifungal medications, and there is one anti-seizure medication, the name escapes me, it's also used for bipolar disorder, can all lessen the effectiveness of the birth control pill. It may increase your risk for blood clots, so you need to teach your patients signs and symptoms of DVT and preferably PE. Fertility can return immediately following discontinuation. There is another myth out there that when you stop taking the pill, it's going to take you at least 3 months to get pregnant. Not true. So just be aware that fertility can return immediately. Doesn't always. Does not provide protection from STIs, combined with condoms for that. Okay, transdermal patch. And they go under different names. They need a prescriber's order. You pick them up at the pharmacy. It's a 2-inch square transdermal patch, contains an estrogen and a progestin. People like this better than the oral contraceptive because they only have to remember it once a week. There is a slightly increased risk for thromboembolism over the COC. The big thing that you need to remember, and why I bolded it and italicized it, it is less effective in women who weigh more than 198 pounds. It can be placed on a lot of areas of the body, the torso, the buttocks, the upper outer arm, but you should not place it on the breast. Apply for 3 weeks, remove for 1 week, apply a new patch at the end of that week. It can cost up to $150 out of pocket. Out-of-pocket costs apply to people who either don't have insurance of any kind or they have an employer who has a religious exemption to contraception. All other types of third-party payers, including Medicaid at this particular moment in time, do cover contraception. They are required to by law. Vaginal ring, NuvaRing, Anovera. These contain estrogen and a progestin. And like the patch, they stay in place for 3 weeks and removed for 1 week. Similar risk to combined oral contraceptives, but lower side effects. The woman inserts the ring as far back in the vagina as possible. Precise placement is not necessary. It can be removed during sex if you need to. It stays in place for 3 weeks, removed for 1 week. That week will be your bleeding week. It can regulate cycles for women with irregular menstruation. It can cost up to $200 a month out of pocket. Potential side effects, vaginal irritation for some women, it's uncommon, expulsion of the ring, and increased vaginal discharge. Okay, progestin-only pills. So those were all estrogen-containing methods. Progestin-only are suitable for all those women who can't take estrogen, the people with blood clotting or stroke or diabetes or hypertension. They work by opposing FSH and LH to prevent ovulation, thicken cervical mucus, and thin the uterine lining. They do the opposite of what a normal follicular ovulation cycle would do. Client education, you must take them at the exact same time every day. Even if you miss it by 3 hours, your chances of getting pregnant are increased. And for the first cycle, you should use a backup method with this method. Advantages, you can get it over the counter. So for people who don't have insurance, it's more affordable and it's more accessible as O-pill. It has fewer side effects and adverse effects than the combined oral contraceptives, and it's considered compatible with breastfeeding, but ideally you would counsel the mother to wait until the milk supply is well established. Once that prolactin has done its job and she's got a milk supply, it's good to go. There are some women who will start it right away, just same as Depo, we give it in the hospital, but it can impact milk supply if you start it early. It does have a higher failure rate than this combined oral contraceptives do. It's not as good even when used perfectly to prevent ovulation. It does not provide protection against STIs, and it is contraindicated for people who have breast cancer, liver disease, and anybody who's had bariatric surgery, because this one is absorbed in the part of the small intestine that might be impacted by that. All right, injectable contraception. This is another progestin-only method. Also goes by the name of Depo-Provera. It is an IM injection. It's good for 3 months. And it's okay for people who can't get anything with estrogen in it. Same people, stroke, blood clotting, diabetes, hypertension, they're all okay to take this. It prevents pregnancy by 3 mechanisms. Inhibits ovulation by suppressing FSH and LH, like they all do, thickens cervical mucus, and inhibits the growth of endometrial lining. The one side effect from both the progestin-only pills and Depo-Provera is that they can have irregular bleeding. In most cases, their bleeding will decrease, but they may have breakthrough spotting or bleeding between periods. They may not get periods at all. And that's one of the things that makes people discontinue their method. If they're okay with that, then you're okay to go with it. The advantage is it's discreet. Nobody knows but you and your provider, or nobody has to know. If you are, hiding it from your parents or whatever. Also, it reduces user error as long as you remember to go back and get it every 3 months. It's effective. It's reversible. Your fertility returns as soon as that last shot wears off. Out of pocket will cost you $150 a dose. Although if you go to Planned Parenthood, there's a sliding scale for everything they offer, and you could get it for free through third-party payer insurance. Side effects, same as the POPs, acne, weight gain, depression. And next we have the Nexplanon, or hormonal implant. This is one of your LARCs, or long-acting reversible contraception methods. It goes under the skin in your upper arm. It's a time-release implant. It contains a progestin and it inhibits ovulation. This can also cause irregular bleeding. It's relatively discreet, although you can, if you look in just the right place, sometimes see it under the skin. Fertility is restored immediately on removal. It provides greater than 99% effectiveness over 3 years, and there is no user error. And it's not likely to be expelled like an IUD, so this is one of the most effective methods. Side effects, same as all the progestins: weight gain, acne, depression, irregular bleeding. It requires a minor surgical procedure to remove, and sometimes they're a little difficult to remove. The cost, if you are paying for this one out of pocket, you are paying for surgery. It's $2,300. And that's significant, but if you average it out over 3 years, it's a lot cheaper than having an unwanted pregnancy. If you're covered by insurance, this is an excellent method. Emergency contraception, we're just going to touch on this. They work by preventing ovulation, and I'm including it with hormonal because most of the methods that are familiar to people are hormonal. These can be taken 1 to 5 days after an unprotected act of intercourse, or if a contraceptive method like a condom fails. Types, we have ulipristal. This is Ella. It requires a prescription. It's more effective than Plan B. It's less effective for women weighing more than 195 pounds, so that's a consideration. But you can get it ahead of time, like, women who run the risk of becoming accidentally pregnant, certainly women who, through no fault of their own are sexually assaulted, should have access to this. And you could plan ahead and get it through a mail order service like NERCS or HERS. They do accept insurance. There's an over-the-counter Plan B, levonorgestrel. It's less effective for women weighing more than 165 pounds, and it's less effective than Ella, but it is better than nothing. Then we have, this is the next unit, IUDs, but they can also be used. It used to be that only the copper-containing ones were used, but according to the Planned Parenthood website, they can now use Mirena and Liletta, which are types of levonorgestrel-containing IUDs, and they are just as effective as the copper IUD. They are the most effective methods. They work regardless of the patient's weight. However, they are expensive. They can be up to $1,800 to insert. And this is a long-term solution. This is not something you do once and then you go back to normal. So if it's just like, hey, normally things go well, but I forgot to take 2 pills, that might not be the method for you. You might be better off with Plan B or Ella, but you do need to counsel your patient that this is not 100%. If there already is a fertilized ovum, there is a chance at pregnancy. It only really prevents ovulation. Okay, we're going to go to the next unit, but I'll let you have a break.